Thanks for joining us for this symposium. I'm Bill Rapisi, President and CEO of the Lymphatic Education Research Network. LE&RN's mission is to fight lymphatic diseases through education, research, and advocacy. In order to win a fight, you first have to join it. So we ask, please become a supporting member of LE&RN at lymphaticnetwork.org. And we hope you enjoy today's symposium. Thank you.
Hello, and welcome to the live stream symposium, The Key to Success for Lymphedema Products and Insurance Coverage. My name is Marianne Luh, and I am the founder of Luna Medical. Many thanks to the following companies for their generous support making the symposium series possible. Please take a moment to review an important disclaimer on behalf of the Lymphatic Education and Research Network. Regarding disclosures, I am the CEO and owner of Luna Medical. As an employee, I function as the Director of Insurance Contracting and as a national educator for insurance coverage and compression textiles. I am also a fitter for medical compression. I have spent the last 24 years of my career advocating for lymphedema awareness. Today, the Luna Medical team, with corporate headquarters in Chicago, Illinois, assists patients with their lymphedema product needs nationwide. Now let us begin, and thank you for joining us with the key to success for lymphedema products and insurance coverage. We will have a question and answer forum at the end of the presentation, so please post any questions you may have on the chat room. Topics for discussion will include the different types of insurance payers: commercial, federal, Medicare, Medicare replacement HMOs, Medicare supplemental insurance versus Medicare secondary insurance, Medicaid, self-funded employer groups, Tricare, and the Veterans Administration. You will understand the difference between in- and out-of-network benefits for compression products, how to locate an in-network ancillary provider, and what should be expected from them. It is estimated that there are 10 million lymphedema cases in the USA. Lymphedema can be caused by lymph node dissection, endoradiation secondary to breast, melanoma, prostate, gynecological, or head and neck cancer. For survivors, lymphedema serves as a constant reminder of what they went through during treatment. Children are born with the condition where onset is at birth, at puberty, or later in life. Patients can have chronic venous disease, which also impacts the lymph system. A history of deep vein thrombosis, cellulitis infection, trauma, or even saphenous vein stripping can be the cause for onset of venous lymphatic insufficiency. Lymphedema patients have a very difficult time with the stubborn edema they are burdened with. According to the American Cancer Society, 1 in 8 women will develop breast cancer. There are 3.1 million breast cancer survivors in the USA. This includes those that are in active treatment. It's estimated that 30% of patients undergoing breast cancer surgery and/or radiation will develop lymphedema. That's 930,000 survivors living with lymphedema. The 5 largest commercial insurance companies in the U.S. are United Healthcare with 70 million subscribers, Anthem with 39.9, Aetna with 23.1, Cigna with 15, and Humana with 14.2. Commercial insurance companies have clinical coverage policy guidelines available online for lymphedema products. If you Google lymphedema products, clinical coverage policy bulletin, you can locate their most recently updated guidelines, typically reviewed yearly. The insurance companies and their case managers have become increasingly more familiar with the diagnosis of lymphedema. These bulletins include lymphedema products covered by their billable codes and even refer to names of manufacturers. They also review products that are not covered, deeming them as experimental, such as truncal garments. Insurance companies recognize reimbursement for compression products providing they are 20 millimeters of mercury pressure or higher. So what is an ancillary provider? It can be a durable medical equipment company, also known as DME, or it can be an orthotic and prosthetics company, also known as O&P. An ancillary provider is licensed and insured to provide medical products to patients for their use in their homes. They are required to have an active Medicare supplier number and to be accredited by an organization such as the Joint Commission. They protect your private health information. They maintain patient records including demographics, clinical history, physical prescription, measurements, and product order history relevant to your future ongoing relationship with your lymphedema medical product needs. Larger insurance companies contract directly with ancillary providers. Smaller insurance companies contract with insurance networks who contract directly with ancillary providers. What should you expect from an ancillary provider? Verification of insurance benefits. Ancillary providers have access to insurance benefits for medical products via online portals and can confirm information with insurance company representatives as needed. Insurance authorizations. Daytime elastic support and inelastic wraps typically do not require prior authorization. Night-type garments and lymphedema pumps may require pre-authorization. It just depends on the insurance policy. Obtain certificates of medical necessity from referring physicians. The therapist can provide the patient face sheet, initial evaluation, which includes the clinical history, a signed notice of privacy practices form, and lymphedema products requested to the ancillary provider. The ancillary provider can obtain the CMN from the doctor. Order medical products in a timely manner. If no authorization is necessary, products should be ordered within 24 hours, providing the patient has given the consent to proceed. One set of elastic support should be ordered to make sure it fits okay before ordering a second set for wash and wear. Handles all returns, alterations, and replacements. Be sure your provider is following the manufacturer's return policies. As long as it is called into the manufacturer within 30 days of delivery to the patient, it can be documented as a return authorization. The manufacturers will want to have the patient try washing and wearing the elastic support before a return takes place. Often washing and wearing elastic support 2 to 3 times results in a product that is perfectly fine. Sometimes it could be doffing issues that can be resolved. There are times when we need to make fabric compression class or measurement changes. If a patient is in a ready-to-wear and it turns out they need custom, the manufacturers will credit the ancillary provider for the ready-to-wear towards a custom-made product or different ready-to-wear size and or compression class. The ancillary provider can order the replacement product and after the patient receives it, can send a prepaid return authorization packet to the patient to send the returns products back to the manufacturer for credit to the provider. Note all products are laundered before being returned. Files claims to insurance. An in-network ancillary provider will file the claim to the insurance company and bill the patient any deductible and or coinsurance that may be due after the claim has processed. File appeals on behalf of patients. A company with integrity and advocacy will take the time to file appeals if a claim is wrongfully denied on behalf of the patient. Consultation with certified fitters. These fitters can be consulted with regarding patient orders. For very difficult cases, such as patients with lobules or weeping wounds, the provider can reach out to the manufacturer's medical education advisors and collaboratively the lymphedema therapist, ancillary provider, and manufacturer can discuss suitable options for compression products. Maintains patient records. Ancillary providers are accredited and must maintain patient records, including a signed notice of privacy practices on file. Patients' measurements are housed in the electronic records that can be referenced for future orders. Provide custom and non-custom lymphedema products. It is absolutely necessary for a lymphedema patient to have access to custom-made compression products. Contracted in-network with patient's insurance company. If the ancillary provider is not contracted in-network with the commercial insurance company, the patient will most likely pay the entire claim out of pocket. You must refer to an honest provider that truly cares about the well-being of lymphedema patients, a partner and advocate for their lifetime needs. Insurance companies recognize the need for patients to have one set of elastic support for wash and one set for wear. Some policies allow for 2 to 4 sets per year and some have unlimited. They do recognize payment for claims including custom-made compression products per patient condition. inelastic and non-elastic daytime, nighttime wraps and garments every 6 to 12 months. Lymphedema pumps and/or pump accessories are typically recognized for purchase every 5 years if needed. Decongesting short stretch garments covered for treatment phase. Bandages are typically not a covered item. What about internet companies? Internet companies are not licensed, insured, and contracted as durable medical equipment or orthotic and prosthetic companies, so they cannot bill your insurance company. Ancillary providers can also have internet stores offering private pay and/or out-of-pocket pricing. Understanding insurance benefits. The premium is the amount the policyholder and/or sponsor employer pays every month to the insurance company for health coverage. An insurance deductible is the amount the insured must pay out of pocket before the health insurer pays a percentage of their health care claims. In addition to paying a deductible first, the coinsurance is a percentage of the total cost of the claim that the insured person must pay. For example, a patient has to pay 20% of the cost for a lymphedema product after the deductible has been met. The insurance company pays the other 80%. An insured person's out-of-pocket expense limitation is the maximum out-of-pocket they will pay in their plan's calendar year. After the maximum is met, the health insurance pays health care claims at 100%. This is an accumulation of the deductible and all coinsurances paid on claims. Co-payments usually apply to lymphedema therapy appointments with the physical therapist or occupational therapist. Co-payments do not apply to deductibles or out-of-pocket expense limitations. For example, a patient makes a $50 copay for a physical therapy appointment. It is paid each time the particular service is obtained. All types of insurance plans contract with ancillary providers to receive an agreed and set rate for compression products. HMOs, or health maintenance organizations, is where patients are required to choose a primary care physician within the healthcare network to monitor the patient's health care and refer patients to other in-network providers for additional health care. Patients must access an in-network provider in order to obtain any coverage for lymphedema products. A PPO, otherwise known as a preferred provider organization, these are fee-for-service health plans. It's not required to see a primary care physician before seeing a specialist. Point-of-service health plans combine characteristics of HMO and PPO plans. A patient is required to choose a primary care physician within the healthcare network to monitor the patient's health care and become their point of service. Your PCP must be consulted before seeking care for in-network health care. For PPO and point-of-service plans, if you choose an ancillary provider for lymphedema products that is not contracted with your insurance, the claim will be paid out of network with a much higher deductible and at a much lower percentage. This is after a separate out-of-network deductible is paid. Any in-network deductible that has been satisfied will only be applied to in-network benefits and vice versa. Here's an example of some insurance benefits. As you can see on the left, the HMO has no coverage for out-of-network providers. And then here on the right, you can see an example where there's in-network and out-of-network benefits. That $1,500 in-network deductible, for example, only applies for in-network service, and the out-of-network only applies to out-of-network service. And as you can see, the out-of-pocket expense limitations will vary greatly, as well as the percentages covered. So it really makes no sense to use an out-of-network provider. So have a menu to navigate your referrals, to navigate your patients to in-network providers. What does it mean when a provider says, sure, I can file your claim to your insurance? They can file the claim since they are a licensed ancillary provider. However, they do not tell you that they are not contracted in network. The end result is the patients pay a higher price for the product and the entire claim is paid out of their pocket. We hear so many horrible stories of patients being told by providers that there is no coverage for their lymphedema products and they do not check benefits. Patients paid for the products out of pocket, and the sad reality is that the patient actually had coverage. Don't let the jokers run wild. The therapist, after receiving insurance benefits from the provider, can educate the patient about elastic support, circulant versus flatnet, inelastic support, and nighttime garments. The therapist discusses what products would best manage the patient's lymphedematous condition at home. Do not allow a patient's insurance benefits or private pay scenario get in the way from discussing what products would be most beneficial for home management. Sometimes therapists are making a decision that a patient cannot afford certain products, so they resort to considering a patient for a ready-to-wear circular knit stocking when they really need a flat knit custom stocking, as an example. Patients have family members. There are foundations. We must look at the patient's compression product needs and then see what can be done from a financial standpoint. A patient is not covered at 100% for lymphedema treatment. It can cost them thousands of dollars out of pocket. Often patients have a copay per visit and a maximum number of visits per year for PT or OT. If we don't follow through with the products for proper containment, we are being a disservice to our patients. Elastic and compression exclusions. Stockings can be listed as an exclusion on insurance policies. In this case, the patient must pay out of pocket. Having insurance benefits verified by the provider allows therapists the ability to discuss any exclusions with their patients that might influence product choices. If it is unclear in their benefits, the provider can do a predetermination of benefits with the insurance company. United Healthcare, Aetna, and Humana have unfortunately taken the liberty of writing elastic and compression exclusions into their policies, despite a patient's diagnosis of lymphedema, chronic venous disease, or lipedema. End result is the insurance company keeps the funds for compression in their own pockets. They pay zero. We need your help. I've created a survey. We're conducting a survey concerning the commercial insurance companies with elastic and compression exclusion policies. It will only take a couple of minutes of your time. It is open for patients, caregivers, clinicians, everyone and anyone that wants our voices to be heard regarding these policies. Medical compression for patients diagnosed with venous and lymphatic disease, as well as lymphedema, are not convenience items. They are medically necessary. What's a fully insured versus a self-funded health plan? Fully insured health plans is where the employer contracts a commercial insurance company to cover their employees and their dependents. A self-funded health plan is when the employer provides health benefits to employees with their own funds. In other words, the employer is self-funding the plan and assumes all the risk for payment of the medical claims. Self-funded plans are provided by large employer groups. Self-funded plans contract with third-party administrators for assistance in claims education and payment. Commercial insurance companies offer these services and call them administrative services only contracts. Third-party administrator services give the employer groups access to in-network providers. The self-funded health plan will have similar terms for eligibility and covered benefits as a fully insured health plan from the commercial insurance companies. If a patient is having difficulty getting the treatment and or home medical products needed for successful management of his or her lymphedematous condition covered through the third-party administrator, they can navigate their way to the Human Resource Department. Remember, you are in a self-funded insurance plan. Denials can be overturned and approved through HR. An example of this can be an airlines group, teachers union, large employer groups that are self-funded. Flex spending and health savings accounts. Medical and health flex spending accounts are special accounts you put money into for permitted out-of-pocket medical and dental expenses. They can be used for medical compression products, including lymphedema products, travel socks, and sports compression. They're only offered through job-based health plans. No taxes are paid on these funds. Can be used for co-payments, co-insurances, and deductibles. Cannot be used for insurance premiums. Typically, you can put up to $2,550 into a FSA each year. The employer sets the limits. Patients can sometimes have FSA debit cards, called flex cards, that are used to access account funds for eligible expenses. The BlueCross BlueShield Association is a national federation of 36 independent, community-based, and locally operated BlueCross and BlueShield companies. The association owns and manages the BlueCross and BlueShield trademarks and names in more than 170 countries and territories around the world. The association grants licenses to independent companies to use the trademarks and names in exclusive geographic areas. BlueCross and BlueShield companies provide healthcare coverage to more than 105 million people, 1/3 of all Americans in all 50 states, the District of Columbia, and Puerto Rico. The BlueCross BlueShield Federal Employee Program. BlueCross and BlueShield companies enroll in the Federal Employee Program, otherwise known as FEP, the largest privately underwritten health insurance contract in the world. More than 5.3 million federal government employees, dependents, and retirees. Moreover, the Blues have enrolled more than half of the U.S. federal workers, retirees, and their families, making the Federal Employee Program the largest single health plan group in the world. An ancillary provider contracted in network with one BlueCross BlueShield company can provide lymphedema products payable in network to patients with the Federal Employee Program nationwide. Anthem is the largest BlueCross and BlueShield company spanning 14 states. As you can see, some BlueCross BlueShield companies are multi-state and some are single-state. The 36 independent companies will not compete with each other. For some states, there are 2 BlueCross and BlueShield companies. For example, Anthem covers all of Virginia except Northern Virginia suburbs. Care First covers the Northern Virginia suburbs. An ancillary provider must be contracted with each BlueCross BlueShield company in order to be an in-network provider. Tricare is the healthcare program for United States Uniformed Service and National Guard Reserve members, including active, retired, and their families. Tricare is managed by the United States Department of Defense with an annual budget under leadership of the Assistant Secretary of Defense for Health Affairs. Tricare is divided into 2 regions. West is administered by Health Net Federal Services. East is administered by Humana Military Services. An ancillary provider must be contracted with each region to be considered in-network. The Veterans Health Administration healthcare program is for the United States members that served in the active military, naval, or air services and separated under any condition other than dishonorable. Lymphedema product coverage is handled by each individual VA hospital. They may use a local ancillary provider, or they may provide products at the VA hospital's O&P department. The VHA is a component of the United States Department of Veterans Affairs led by the Undersecretary of Veterans Affairs for Health, typically a physician responsible for the administration and operation of the VA medical centers, outpatient clinics, and community living centers or nursing homes. The VA operates the largest integrated healthcare system in the United States. Medicare is a federal health insurance program administered by the U.S. federal government. Medicare provides health insurance for Americans aged 65 and older who have worked and paid Social Security taxes into the system. It also provides health insurance to blind or disabled individuals, including younger people. The Medicare program is administered by the Centers for Medicare and Medicaid Services, CMS. Medicare does not pay for lymphedema medical products because compression supplies cannot be classified under any existing benefit category in Medicare statute law. The Center for Medicare and Medicaid does not have the authority to add or redefine benefit categories. Only Congress does, hence the need for legislation. Medicare replacement HMO policies. These managed care health plans are administered by a commercial payer. Since these plans follow Medicare guidelines, they will not pay for lymphedema medical products. The Lymphedema Treatment Act was introduced to Congress in 2010 to amend Medicare statute to allow for coverage of compression supplies. I encourage you to visit their website. Medicare supplemental insurance versus Medicare secondary insurance. Medicare supplemental insurance are individual health insurance policies, often called Medigap, to supplement a patient's primary Medicare insurance. Medicare covers 80% and Medigap covers 20% coinsurance. They're offered by commercial carriers for a monthly premium. Since Medicare does not pay for lymphedema products, the supplemental plan will not pay either. Medicare secondary insurance are group health insurance policies to supplement a patient's primary Medicare insurance. They're offered by a former employer, typically as a retirement benefit for a monthly premium. Eligibility includes large employer groups, Tricare members, state government employees, and unions. If a patient has a Medicare secondary insurance, the policy may provide coverage for lymphedema products secondary to a Medicare denial. The provider needs to be a Medicare provider and should be contracted as an in-network provider with the secondary insurance. The provider bills Medicare and the Medicare denial and files the denial to the Medicare secondary insurance for review and payment. The secondary insurance may pick up as the primary payer, subject to any deductible and/or coinsurance that may be due. This is not a guarantee. Women's Health and Cancer Rights Act of 1998. This required coverage includes all stages of reconstruction of the breast on which the mastectomy was performed, surgery and reconstruction of the other breast to produce a symmetrical appearance, prostheses, and allows for treatment on physical complications secondary to a mastectomy, including lymphedema. It was passed for group health plans, insurance companies, and health maintenance organizations. If an insurance company is not providing coverage for lymphedema products for a breast cancer survivor, a formal complaint should be made to the Department of Labor directly on their website. Unfortunately, this law does not apply to Medicare. State Insurance Commissioner. An insurance commissioner is a public official in the executive branch of a state that, along with his or her office, regulates the insurance industry. The powers granted to the office of an insurance commissioner include approval of insurance rates, periodic financial examinations of insurers, licensing of companies, agencies, agents, and brokers, monitoring and regulating claims handling. Could a complaint be made to your state insurance commissioner? Sure. Is your insurance company saying that you have no coverage for lymphedema products because they are considered convenience items? Or are they saying that they're disposable supplies? It can't hurt. I'd go ahead and place a complaint with your state insurance commissioner about these insurance companies having exclusion policies for your compression products when you have a diagnosis of chronic venous disease, lymphedema, or lipedema. There are very few providers for lymphedema products that are contracted in-network with insurance companies. There are ancillary providers that have national insurance contracts and exceptional service and accept measurements from lymphedema clinicians. Insurance companies refer to HCPCS Level 2 codes for contracting with providers for lymphedema products that are not covered by Medicare. Insurance companies have established fee schedules for these items. For ancillary providers contracted in-network, the provider must accept the allowables. These are the codes for upper extremity products. These are the codes for lower extremity products. Medicare has established HCPCS codes for lymphedema pumps, so they refer to them as HCPCS Level 1 codes. Decongesting garments are now being used at lymphedema clinics during the treatment phase for successful reduction of limb girth. They can be covered by insurance. Lymphedema affects patients physically, psychologically, and financially. It's imperative that lymphedema patients have the appropriate compression products, custom or non-custom per patient condition, in order for them to take control of their chronic lymphodematous condition. Therapists need to drive patient referrals to in-network ancillary providers. For those patients with no insurance, the same providers again may offer competitive private pay pricing. We need to provide a community of support with lymphedema awareness among lymphedema patients, lymphedema therapists, caregivers, advocates, foundations, medical compression providers, physicians, and insurance companies. Measuring videos and workshops are available from manufacturers. It's landmark measurements and the pull of the tape. And it's nice when patients can be measured right out of their bandages with their decreased girth in their extremities, and then the bandages can be applied afterwards to maintain that decreased girth. The National Lymphedema Network is a nonprofit organization founded in 1988 to provide education and guidance regarding lymphedema management to patients, healthcare professionals, and the general public by disseminating information on the prevention and management of primary and secondary lymphedema. Every year, the Maryland Westbrook Garment Fund helps many patients who do not have the means to buy their own garments. The garments give our patients the hope that they need to continue to live and make positive steps in their lives. Referrals are easy for insurance claims. The ancillary provider needs the patient face sheet, the patient initial evaluation regarding the clinical history, and the measurements. The Notice of Privacy Practices can be submitted with the initial request for insurance benefits. After patients have undergone lymphatic treatment, we must be mindful of the last and most important piece of the puzzle. It's imperative that patients have the appropriate and properly fitted compression products for successful home management of lymphedema, and/or chronic venous disease. I hope you found this presentation resourceful and educational to provide you with a clear understanding of insurance coverage for lymphedema medical products. Many thanks to the Lymphedema Education and Research Network for this opportunity to educate the lymphedema community and for your mission to fight lymphatic disease and lymphedema through education, research, and advocacy. Thank you for your time. Thank you for joining us in the chat room. Our first question is, what Facebook groups do you recommend for patients with lymphedema? I recommend LympyStrong. Veronica, who goes by Vern Cineras, is a patient, advocate, and founder of LympyStrong. She also serves as the co-chair for LE&RN, Texas chapter. Her Facebook page is www.facebook.com/group/Lympy, spelled LYMPHI, Strong Inspiration Group. Next question. When I call my insurance company and ask them to provide me with an in-network provider for lymphedema products, they give me a long list of ancillary providers. I called all of them and nobody provides compression. Now what do I do? You can contact the provider of compression listed on the manufacturer's websites. However, you will still need to be mindful that they may not be contracted in-network. There are ancillary providers with national contracts. Your local lymphedema therapist may be able to provide you with a company, or feel free to contact myself at mluh@lunamedical.com and I can see if I can help. Next question. I called my insurance company and asked them if my lymphedema products are covered by insurance, and they asked me what the billing codes were. It is for a nighttime garment to sleep in for my lower extremity. I did not know what information to give to them. It gets tricky. When patients call customer service at the insurance companies, when it comes to the HCPCS Level 2 code items, they don't typically provide the correct information. You should have an in-network provider check the benefits, as it always has to be checked by the contracted provider that will be providing the garment to you anyway. They will have item descriptions and fee schedules in place with that insurance company. Next question. My commercial insurance company has written an elastic and compression exclusion policy into my insurance plan. They paid for my lymphedema therapy and they exclude my compression needs for home management from my coverage? I pay a lot of money for my insurance. What can I do? Unfortunately, these policies have been made with poor judgment by the insurance companies that have them. Given the chronic nature of venous disease, lymphedema, and lipedema, it makes no sense other than the pure fact that they don't want to pay. There are two things you can do for now. Fill out our survey just posted via SurveyMonkey to collect data and feedback from the lymphedema medical community. This will be a great tool to get a team of lymphedema experts in front of the clinical coverage policy teams at these commercial insurance companies to discuss the removal of these exclusion policies. The link is www.surveymonkey.com/R/P22K. You can also find this link on the LE&RN website for the live symposium and on the Luna Medical website at www.lunamedical.com. You're also welcome to share this link via social media or any kind of support group or advocacy groups so we can get as much feedback as possible from the lymphedema community. 2. File a complaint to your state insurance commissioner. If you Google State Insurance Commissioner and click on your state, you can follow the prompts. Make sure you include your diagnosis and all the details about your condition and treatment, how they have exclusions for the products you need to successfully manage your chronic condition at home. As additional questions come to mind, please feel free to email me at mluh@lunamedical.com.